It usually starts with something small. A child is running through a park, stops, and complains that their leg hurts. They're inexplicably tired. They don't want to play anymore. Naturally, the parents take them to a pediatrician. The doctor checks them out and offers a common explanation, a passing virus, or maybe just standard growing pains. But months go by, and the pain doesn't resolve. In fact, it gets worse, and new symptoms appear. The pediatrician, now unsure, writes the first of what will become a very long list of referrals to specialists. Standard protocol has created a dangerous blind spot, initiating a cycle of exhaustion and physical decline while families wait for answers. Pop culture trains us to expect a medical mystery to be solved in a week. We picture a brilliant doctor and a dedicated team running test after test, focusing entirely on one patient until they crack the case. The reality for rare disease patients is entirely different. Medical professionals have a specific term for what these families actually go through: the diagnostic odyssey. Looking at this timeline, the scale of the delay becomes clear. According to the National Organization for Rare Disorders, the journey to a correct diagnosis takes an average of 5 to 7 years. During that stretch, patients endure multiple misdiagnoses and undergo countless rounds of testing that yield no definitive answers. For some, the right answer never comes at all. Time itself becomes the primary adversary. The healthcare system, designed to heal, instead operates as an exhausting labyrinth. This text highlights one of the first major roadblocks. It lists severe disease manifestations: hematologic, visceral, and skeletal. Yet in their early stages, these symptoms closely mimic highly common everyday illnesses. General practitioners face a massive volume of these common complaints. Because a rare disease is exactly that, rare, most doctors will go their entire careers without encountering a single case of a specific condition. This kicks off a referral maze. A patient is sent from a rheumatologist to a hematologist, then to a neurologist. Each highly specialized doctor evaluates the patient exclusively through the lens of their own specific field. They are looking at isolated symptoms. These disparate specialists linearly have the opportunity or the infrastructure to share a unified, holistic view of the patient's entire medical chart. Modern medicine is heavily decentralized, making it poorly equipped to identify conditions that affect multiple bodily systems simultaneously. To understand the physical cost of a 7-year delay, we have to look at what happens at the cellular level. Type 1 Gaucher disease offers a clear example of this internal timeline. Here, healthy macrophage cells are shown patrolling the body's tissues. If we zoom inside a single macrophage, we can observe the root of the problem. An inherited mutation in the GBA gene causes a critical deficiency in an enzyme called acid beta-glucosidase. Without enough of this functioning enzyme, a fatty substance known as glucosylceramide, or GL1, cannot be broken down. Instead, it rapidly accumulates and expands inside the cell's lysosomes. As GL1 builds up, the macrophage becomes massively engorged, transforming into a Gaucher cell. These bloated cells accumulate and crowd out healthy tissue in the spleen, liver, and bone marrow. Identifying this exact process requires a specific enzyme assay to confirm the deficiency. But this confirmatory test is highly specialized, often misunderstood by standard providers, and difficult to access. Waiting years to finally receive this test has compounding consequences. Families face mounting financial costs from repeated, inconclusive doctor visits, while the unchecked cellular buildup causes irreversible physical damage to the organs. The diagnostic delay is a prolonged period of unchecked physical disease progression and severe psychosocial trauma. The medical community is now deploying new methods to compress this 7-year ordeal into a matter of months or even days. Expanded newborn screening programs are one of the most effective interventions. They can identify genetic markers for diseases like Pompe or spinal muscular atrophy before any physical symptoms ever manifest. Here, a scientist analyzes complex data. Using advanced genetic testing and precision medicine, researchers can pinpoint the exact molecular cause, entirely bypassing years of guesswork. Artificial intelligence is also proving to be a highly effective tool. AI systems are now capable of rapidly scanning massive databases of patient records. By conducting automated chart audits, these systems flag hidden symptom patterns scattered across different specialist notes, alerting doctors to a potential rare disease years earlier than a human could. Emerging data technology serves as the bridge between fragmented medical records and a life-saving, timely diagnosis. Early detection completely transforms this journey, providing immediate access to targeted disease management and stabilizing the patient's future. Every single year without a correct diagnosis is an unnecessary year spent without answers and without treatment. By raising awareness and pushing for better diagnostic tools, we can actively work to shorten the diagnostic odyssey for millions of people. Subscribe to Rare Disease Insights to learn more, share these stories, and support the community as we work to change the reality of rare diseases.